Hello and welcome to today's tip brought to you by Logix. My name is Tom Klitsch. Today we're going to speak about the different personality traits when collecting money from your patients. How to identify a results-oriented patient? Well, the tone of their voice is going to be little or no variation. Their characteristics are going to be impatient, brisk, may even seem argumentative at times. They're going to be loud and forceful in the volume of their voice. They're going to be very limited or short pauses when they speak. They're going to be self-assured, to the point, and they may seem restless at times and may interrupt many times during your conversation. Once you identify a patient like this, these are the steps you're going to take. Begin by getting to the point quickly. Have a rapid pace in your voice and limited emotions. Don't take offense and be firm with the evidence. Outline the options and ask for a commitment. You can usually identify a socially oriented patient by a lot of variation in the tone of their voice. They're very warm and enthusiastic and speak loudly and lively. They usually have very few pauses when they speak, and they're emotional. They give a lot of detail and usually like to talk about themselves. Their responses are very long and they talk a lot. When you've identified this type of patient, this is how you want to respond. You want to begin by being casual and friendly. Speak at a rapid pace with enthusiasm and emotion. Be empathetic. Let them talk. Be upbeat and encourage action. A process-oriented patient can be identified by the tone of their voice. They're usually monotone. They're quiet, cautious, unemotional, and very controlled. Their pauses are usually long, and there are many more of them. They are usually very direct and little small talk, and they use logic to get their point across. When you've identified this type of patient, these are the actions you need to take. You want to begin by being reserved and wait for them to respond. Have a slow pace and limited emotions in your voice. Give the patient plenty of information and logical evidence. Offer options and give them time to decide. When identifying a relationship-oriented patient, usually there's some variation in the tone of their voice. Their characteristics are usually calm, agreeable, and they like to avoid conflict. Their volume is usually soft-spoken, and in the pauses, they're very moderate, and they'll usually wait for you to speak. When speaking, they're cooperative, helpful, and may seem uncertain. When responding, they respond slowly, and they like to explain fully their situation. When you have identified a relationship-oriented patient, these are the actions you need to take. You want to begin by building a rapport. Be informative and non-threatening. Your voice should be of slow pace and friendly tone. Acknowledge their feelings and offer support. Don't push, but try to secure a commitment. Thank you for watching. We'll see you again next time.